Yes, welcome to another episode. The second episode of endometriosis. The first one, we just mentioned about the general overview and the signs, right? So in this video, we are going to talk basically more of the causes, right? What can predispose you to endometriosis? What can cause endometriosis, right? So that's what basically we're going to talk about here, right? So I hope once more you're going to learn something special, right? So just take 1 second. Just take 1 second to subscribe. 1 second to subscribe, right? Yes, thank you. So please remember to comment, share, and like the video, right? Yes. So what are the causes of endometriosis, right? So we just mentioned that endometriosis is when the lining of the uterus, which is called the endometrium, they grows outside the uterus, anywhere outside the uterus. It can be ovaries, it can be the oviduct, it can be maybe on your colon, right? Or even the ureter, or even the kidney, or even the lungs, right? So what can cause this kind of condition? What can predispose you to it, right? So before I start, the exact cause of endometriosis is not known, right? But there are some things that could predispose you to endometriosis, right? So the first one is what we call retrograde menstruation. Retrograde menstruation. So what happens in retrograde menstruation? This is a situation where you find that during the end of your menstrual cycle, where you are now going through the menses, the menstruation part of it, the menstrual blood that doesn't flow out of your body, right? But what happens? They flow back through the oviduct and into the pelvic cavity, right? So instead of the menstrual blood flowing out of your body, that does not happen. What happens is that the menstrual blood they flow back through the oviduct into the pelvic cavity, right? So if this menstrual blood flow back through the oviduct and into the pelvic cavity, what can happen? So you understand that during this time, this menstruation period, the level of progesterone is very, very low, right? And that's why there's sloughing of the walls of the uterus, the endometrium. So this blood contains endometrial tissue, right? So if you have if you have this thing we call retrograde menstruation, this tissue on the cells of the endometrium, if they flow through the oviduct, there's a high likelihood that they can stick on the oviduct and grow, right? So this kind of cells, right? So this kind of cells, they can stick on the oviduct and they grow, right? So this blood contains the cells of the endometrium and the tissues, so they stick and grow, right? And this can cause endometriosis. So that is retrograde menstruation. So that's one thing that can cause endometriosis. Another thing that can cause endometriosis is what we call the surgical site complication. For example, you went through CS, maybe during your first birth, right? Or you had any surgery, maybe myomectomy, right? Or the CS. So what can happen during menstruation? The blood flows, the menstrual blood flows out of the body, right? So this menstrual blood, they contain the endometrial cells or the endometrial tissues, right? So these tissues or these cells, they can grow on the surgical site, on the surgical site, right? This can cause you endometriosis, right? The third cause is what we call immunosuppression. Maybe you have you are having other condition like HIV and AIDS. Maybe you are having tuberculosis, right? Now your immune system is very low. Your immune capacity is very low. You are immunosuppressed, right? You cannot fight other conditions. You cannot fight any kind of disease, right? So when there's a situation where your immune system is very strong, when this kind of growth starts, right, your immune system can fight them and they can shrink, right? But if you are immunocompressed, right, you're having HIV, maybe in the last stage of HIV and AIDS, maybe tuberculosis, right, maybe cancer, right, and you have a very, very weak immune system. So your body system cannot fight this kind of other condition, right? So if you have this kind of growth, maybe your body cannot fight them, right? Yeah. So those are three main causes of endometriosis. What can predispose you to it, right? One thing that can predispose you to endometriosis is family history of endometriosis. Maybe you have your aunt, maybe you have your mother, maybe your sister is having the same condition. There's a high likelihood that you may have it, right? The family history of endometriosis. There's a high likelihood that you may have it, right? So what can you do? What can you do? Maybe ask myself, maybe my mother is having endometriosis, maybe my sister, maybe my aunt is having endometriosis, right? What can I do? Get pregnant as early as you can, right? Get pregnant as early as you can, right? But again, don't just rush to get pregnant when you are ready, right? But one of the things that help you to manage endometriosis is pregnancy, right? So the first one is family history of endometriosis. Another thing that can predispose you to endometriosis, an empty uterus, right? What do I mean by an empty uterus? Maybe you are married, you are family planning, you are planning maybe to have one kid, and you are planning maybe to have it after 10 years of marriage, right? So during these 10 years of marriage, you are not getting pregnant, right? You have an empty uterus. So how can this predispose you to endometriosis? During menstruation, we've just said that this menstrual blood is made up of the endometrial tissues, is made up of the endometrial cells, right? So during menstruation, there's a high likelihood that these endometrial cells can grow elsewhere, right? They can grow maybe on your ovaries or your ovary, right? So you are in 10 years marriage, but you're planning to have maybe to become pregnant maybe to the 15th year. This high likely you are going to have endometriosis, right? So an empty uterus can predispose you to endometriosis. It sounds funny, but that's the truth, right? So we talked about family history, we talked about an empty uterus. Early menarche, getting your periods very early in life, right? For example, 8 years, for example, 9 years. So you have a long period of time to have your menses. Maybe you are going to start your menopause at 50, maybe at 45. So that's a very long period of time. So this again can predispose you to endometriosis. Apart from early menarche, another thing that can predispose you to endometriosis is late menopause. Maybe you are starting menopause at 55, maybe at 50 something, or maybe 48. What I mean is late menopause. So you still have a lot of time to have your menses, right? To have your menstrual cycle, a long period of time. So that one can also predispose you to endometriosis. Apart from that, what again can predispose you to, apart from family history of endometriosis, apart from early menarche, apart from empty uterus, apart from late menopause, right? So these kind of things can predispose you to endometriosis, right? So get pregnant as early as you can, right? Yes, again, if you are coming from a family where there's family history of endometriosis, there's high chance that you are going to have endometriosis, right? So I hope you learned something. I hope it was some sort of learning. I hope you continue learning. So if you have not subscribed, please remember to subscribe. Just take 1 minute to subscribe. Please like the video, share to your friends, maybe to your families, right? And please remember to comment.